Boy, just got an aha. I just realized something. I guess I always knew it, but it just really hit me just now. As a lawyer, trials are always the most stressful thing that I can imagine. And as I grew up in the career of lawyers, I always got sick the day of the trial.
You bet.
And it got to the point, boy, I'm turning red just thinking about this. I actually had a strep infection one time because I really didn't want to do that trial. But I had a strep infection. I said, it can't possibly be something from outside. I mean, it had to be something from outside. I justified it that much. I had a strep infection.
Sure.
So, boy, what a big aha. Thank you so much.
Yeah, but see, the bacteria is always there. The viruses are always there. The body just says, do I need this right now? Okay. I mean, how many of you, when you were in college, only got sinus infections around finals? Only around finals. Okay, well, one thing is you were already in a stress response. You were using all of your energy, and you were in an anxiety state. Okay, how many times do you go home for the holidays and get sick? I mean, it's not just the food you're eating, but, you know, you're going there with all the people that have all your childhood issues that you've never dealt with. Okay, so let's go home, share mutual unconscious traumas and viruses. And then we go away for the next major holiday, and then we come back and do it again. And we blame it on the turkey. Okay. Here's a key phrase, okay? Look at this formula. I have to be blank to be blank. Now think about that for yourself. I have to be what to be loved? One of mine that I had to deal with is I can live without love, but not without honor. That was one that I could live without love, but not without honor. That was one that was killing me. But you begin to look at that, and how does that fit with their symptoms? What do they have to do? I have to be perfect to be loved. Okay. I have to have money to be loved as a male. I have to not need anyone for anything to be safe. That was one that I carried. Okay. So you begin to look at that, and if that's written on your walls, how much of your body's in a safe, loving response? Versus, I can just tell you for me, mine was, I have to never need anything from anybody ever to be okay. So my metaphor was, I had a castle, and I was always watching the walls to make sure there was no danger from outside and no danger from inside. That doesn't leave a lot of response. And I was aware of my own healing when the castle changed to a temple, and it was open with light and flowers and some other things, and I started using my energy differently. Okay. But begin to ask those questions. I have to be blank to be blank. And you're going to see what are the beliefs. You find out what those beliefs are, and you say, what feeling is there? And when you think about that, what picture comes to mind? Again, what's the earliest picture you have that resonates with that same feeling? Okay. I can't tell you how many environmentally ill people, and I would say, the world's not a safe place. Okay, what's the earliest memory? Well, I was about 3, and I don't know why, but whenever I walked by the neighbor's house, I had that feeling. Well, you want to guess what happened at the neighbor's house? Okay. That's where it started. The world's not a safe place. The other thing is you can inherit those beliefs in the womb. So you can come out of the womb with a belief it's not a safe place, especially if you had a parent that did not want you as a child, or a parent himself that was going through lots of trauma. That is absolutely getting communicated. One of the things that I like to look at with the EFT is let's change that I have to an affirmation. I deeply and profoundly love myself, even though I had the belief that I have to be perfect to be loved. And make that part of that daily meditation that they're doing. Turn the blocking beliefs and the vows into an affirmation. I would turn the blocking beliefs and vows into an affirmation. But something important in that is the unconscious does not hear the no. So you don't say, I deeply and profoundly accept myself even though I no longer have pain. You won't hear the no longer. I deeply and profoundly accept myself even though I'm becoming more and more at comfort or at peace in my body each day. Whatever that would be, but you don't put the no in there because the unconscious doesn't register it. And again, I would say, what is the visual metaphor of self-expression? If you were something in the world, what would that be? A metaphor that I've used with a lot of my clients is, again, my issues were about not letting anybody close. And I was aware that I had a picture of being about 7 or 8 on a playground with all these kids, and I was like in a big packing crate that had bars on it. And I was really angry and pissed off, rattling the door until I realized that the latch had always been on the inside. Okay? And I can't tell you how many clients I could hook with that one. You know, the latch is always on the inside. And beginning them to say, now what picture fits your heart and how you are with people? How are you with your body? What metaphor would you give me of your illness? Okay. And again, things that Gary was talking about is, what are the sensory aspects of the visualization? Size, color, distance. There should be visual changes registered in these aspects as the problems resolve. There's more on that. I really think it's critical to make a life commitment of at least twice a day to do this work on yourself. One of the things that we've had a number of people doing some things like that we've tracked over 4 or 5 years, and to date we've only had one person who's developed a major illness in that period of time if they're doing the work daily. Anybody hear how profound that is? If you are spending 15 minutes every morning and every evening putting your body in a profound healing state and balancing yourself, you will largely prevent disease in your life. Okay. The body is made to self-heal. All traditional medicine does is manage the symptoms while the body heals itself. So if you begin identifying the legs of that table and you start collapsing them, and you're doing that work every day, I guarantee you, your chronic disease process is going to drop down to nothing. I can tell you that since I released the vow and started dealing with things, I have absolutely had more tears in the last 4 or 5 months of my life than I've had in the 49 years I've been alive. But I've had less headaches, a lot less headaches.
Can those vows be from previous lives?
If that's your belief system, yes. I think that whether you believe it's from there or whether it's miasms inherited through family structure, absolutely. Yeah.
Excuse me, Steve, how did you identify what your vows were?
Well, mine were pretty easy because I knew them. I had said them out loud, and most vows have been said out loud. I had 2 things that were keeping me from healing, and I can test, see. You know, do I have a conscious conflict? Do I have a vow? Okay, what's it about? Okay, I knew I had 2. One is I worked too many hours. And I couldn't get healthy working 16 hours a day, 7 days a week. So as soon as I got people trained, I backed off of that. I knew the other one because I knew where the pain was in my life. And when I went into my work every day, what's the issue that came right between my eyes? Right there. Can I heal if I don't change this? No. It's not what I wanted to hear. Can I ignore this for a few more years and stay alive? No. Can I ignore it for 1 more year and stay alive? You know, and begin looking at those issues. Yeah. I noticed it got real quiet there. Questions. I think there's a lot. Well, I'll go in a little bit more, but any other questions right now? I tend to be real clinical because that's my background, so what I want to do is give you clinical pearls that you can take and run with.
Quick question, and that is, does it count the work that we do with others, which are usually among our own issues? Does that work count as daily work in your estimation?
Oh, the old therapist question. Can I take care of everybody else, totally ignore myself, and still heal? Do I think it helps your healing working with others? Absolutely. Would I be real cautious about copping out that way? Yeah, I would. Because if that counted, I would have healed a long time ago, because I work 16 hours a day. It didn't heal my migraines because I had to spend some time with me. And I think the question is, are you worth spending that time with each day? I know your clients are, but are you worth spending that time with each day? And I think you are, so I think you ought to do your own stuff.
Steve, do you treat being counterphobias the same way as you would fears, phobias?
Sure.
Same thing?
Sure.
Flip side of the same thing. Thank you.
I'm going to talk a little bit about the 4 major areas that, did you have another question before I do that? And I'm on page 8 of the outline.
Some people have said that if you're reversed or have environmental toxins, that, in my understanding, you're not going to get good results being muscle tested. And I found for myself that I have troubles getting good results for myself at times, and therefore have doubt whether I am getting good results.
Let me say this, if you have trouble doing this, it's because you're toxic, and 99% of the time, if you have trouble or you're dehydrated, okay? If you're reversed, I can't get good data. But if I'm working with, well, let me just give you an example. I'm working with you right now, okay? Say, and I'm supposed to stay away from that. Say I want to be healthy. Say I want to be healthy. I want to be sick. So you're not reversed, okay? And say this room I want to be healthy. This room I want to be sick. Okay, this room is toxic for you, okay? And so I would know that right now she's not reversed, so I can get good data on her, okay? But I know the room may be influencing it, so I may get more complex treatments than normal for her. If I took her outside and gave her a treatment, it would be less complex. But the other thing is that this kind of bypasses your toxicity level, where if I was muscle testing you, it would be much harder to distinguish a difference. When I'm doing it for you remotely, it bypasses that issue. So it's actually easier.
But what about me doing it for myself?
Can you get a difference?
Yes, but
And let me say this, you can go back to the mic. In general, you're going to have to clean up your own toxicity issues, what you're wearing, or to make it harder.
okay.
Yeah.
Yeah, I can usually get a difference or do work so that I will get a difference, but I will often like get a yes and then ask the exact opposite question, also get a yes, that type of thing.
Right.
So to be able, it's much easier for me to get answers for another person than myself.
Sure. I would look at, there's a lot of stuff in the video that deals with that in terms of when you're switching and doing other things. But the nice thing again is, this is muscle testing with somebody. You have to recalibrate for every person. In California, in many states, you can't touch them anyway. Okay, but you have to recalibrate. This, you don't have to recalibrate. Once you know your difference, that's all you got to do. Okay, if I'm muscle testing you and pushing on your arm, and then I muscle test on him, there's a big difference between how strong I have to push. Every single person in this room, I'm going to have to readjust my pressure to theirs. Okay, plus I can guarantee you that I can do this with a lot less stress than I'm pushing on your shoulder, so I can move a lot faster, I can get a lot more answers, and I can test you like this, and you don't know what I'm doing. You see what I'm saying? Everybody thinks I've got a twitch. You know? But, well, there's a lot of muscle tests so that nobody knows what you're doing, and that's very helpful when you're working with clients. It's also real profound when I say, you know, what about the thing that happened at 3? How'd you know that? You know, it gives them some belief that you know things, okay, which is sometimes helpful with when you're telling them something they don't want to hear. Okay. Let me talk about some areas. It's page 8, charts to scan for beliefs. You're going to have beliefs in 4 major areas that lock out healing responses. I'm bad, and there's variations under that. I'm broken, I'm unlovable. Second one, people are untrustworthy. People will let me down, people will hurt me. The world's a dangerous place. The world is cruel and unloving. I always have to be on guard. The fourth one is God is out to get me. I mean, if you carry beliefs in those areas, I guarantee you're not going to be in a healing state until you address them. Okay. Again, what specific pictures do I have that resonate with these beliefs? What's the earliest memory that resonates with that fear? That's what you're looking at in your core work. The other thing is, I'm just going to go through this real quick so we can get to the demo. The next page, major issues in addressing chronic illness versus acute illness. Chronic illness always involves issues of shame, rage, resentment, unforgiveness with self, family, God, and other healthcare providers. Typically, they have several specific pictures in those areas of anger and resentment that you're going to have to deal with before you get to their healing. They have all been maligned by therapists and doctors who've said, it's all in your head, you know, whatever those statements are. There's nothing there, you know. You're going to have to deal with that before they can trust you. They're going to have to unlock their heart, and they're going to have to clean up that. In chronic illness, you always have to address secondary gain, disability income, lawsuits from the family itself. I did a lot of disability work, and I guarantee you if somebody's waiting for a settlement, they will earn their check with pain every day, absolutely every day. And then once they've passed their lawsuit and they have a monthly check coming in, they'll earn that every day. So actually our disability thing probably injures many more people than it ever helps. It's actually harder for a person with a chronic illness to heal if they have a spouse and an intact family. So you better be willing to do some relational family therapy, because chronic illness is a family disease. If you don't adjust those issues, I can tell you, if the only way I can express resentment is to get back pain so you have to take care of me because you can't hear my words, then that's what's going to happen. You have to address that in chronic illness. Again, if this blank were to go away today, tomorrow I would. Those are real good clinical clues to look for. This, if I say this migraine stops me from doing what? You know, this MS stops me from doing what? And that's just looking for where are the belief patterns. Then there's just some other beliefs to look at there that I think help get you going. I think the other stuff in there is just some clinical notes. I ought to, before I do the demo, I have just a few minutes, and then we'll do a demo after that. I'm going to address some parts work real quickly. That's on page 13, and actually I was going to rewrite that. That was actually, someone did that, just audio taped what I did, and so I never got a chance to go in there and clean it up much. But let me say this, most of us are dissociative. I know I am. It's a great way to be when you have chronic pain. Most chronic illnesses have a lot of dissociation. And if you don't know how to work with those internal parts, those internal heroes, you're going to not progress real well. And there's a simple dialogue in there that I have never had a negative response to. And I know that if you guys use this, you know, and so we're just trying to see if there's any block to letting go of a trauma. Now, I'm not saying any other thing, but for a trauma, anytime I'm 100% ready to release this trauma and I get a no, I guarantee you have an internal part that doesn't understand what you're doing. And if they release the trauma, you release their whole reason for existing. And so you must address that. And I'm not going to look at the notes, but the way I address that, as soon as I get that, is I say, you know, when you're little, if you're bright enough and creative enough and you have trauma, you create these phenomenal internal heroes. And you're bright enough and creative enough. That's what you did. These phenomenal heroes, they come out, they wrap themselves around the trauma, they pull an amnesic blanket around themselves so that you can stay sane and intact. Now the problem with that is those blankets leak over time and they take a lot of energy to maintain. And so I'm going to ask those internal parts if they'll work with me right now. For the first time ever, we have a way of collapsing their pain without having to remember or relive the trauma or tell any secrets. And so what I'm going to ask you to do is, as Jane taps on the outside, I'm going to ask you to tap on the inside. Oops. If it gets too intense, you can just stop. But as you tap away the anger, the rage, the fear, I would like for you to breathe in greater and greater peace and joy and comfort. And I guarantee you, if I go back and say, I'm ready to release this trauma now, you'll get a yes every time. You no longer have blocks to getting rid of it. That's part of, now do I have 100% cooperation in doing this? If I get a no, I'm going to dialogue a little more. There's more dialogue there, and you can modify that. And I just let them know, one of the things I'll tell them, I've never lost an internal part. I don't manipulate internal parts. My job is to give you choices. I will never take away your ability to dissociate off pain. I just want to relieve what you're carrying right now. And then the ability to go in there and clean that out is pretty phenomenal. It's very quick. I've never had anybody say, oh, you think I'm a multiple? You know? And I say, well, I have more parts than you do. I can count parts, so that's the way I am because it works. So I've never had anybody be offended by that, ever. So it's just another tool that's going to be helpful with this population.
I had a comment. I wanted to ask you if maybe this is something we should consider adding to the blocking beliefs, is I want to live versus I want to die.
Sure.
I've muscle tested people for that and watched shock register on their face.
Right.
And they have no idea because it's a
Right.
dissociated trauma.
Right.
But you can imagine if they were 2 and they were being abused, their hard drive recorded, I'd rather die than go through this again. And the other thing is that I look at what I call the energetic signature of trauma, or looking at things symbolically. I have a patient with MS, and she needed to numb her feelings to survive.
Sure.
Her body followed suit.
Right.
And that was an easy call. But when you look at illness,
Look at what it
if their elbow isn't hurting and it's the back of their neck or the back of their heart, there's a huge clue there, chakra or energetically.
Absolutely.
wise.
That's part of that metaphor. You bet.
You just said something about you going to tap on the outside while the client.
All the parts inside of them tap on the inside.
The part. Can you
Right.
explain that?
People with dissociation have internal helpers. You would think of it as internal family therapy. And for lack of a better metaphor, whichever internal family member is standing next to them is the one that they're going to feel the most of their feelings. And so what I'm saying is, whoever's up inside, will you work with me? This is what I'm doing. I'm not taking your existence away. You do not have to look at this trauma. With EFT, we can collapse it completely. You don't have to tell your secrets, okay? And then we can collapse it. And the client often says, well, will I remember what happened? And I'll say, if it's important for your healing, you can ask for that information after the pain's gone. Yeah. Other questions on that parts work before we take a break? I've also never had anybody decompensate doing that. I will tell you that I can do more over the phone in 2 hours spread over 4 months with a multiple than I could do in an hour and a half hypnotherapy and EMDR sessions twice a week for 5 years, because I did that too. Okay. Never had anybody decompensate, ever. I don't have to use the hypnotic containment and then do EMDR within that and then have somebody pick them up and drive them home. Never had to do that with this work, by just using that simple dialogue. Okay. The other thing I'll tell them is, now that, let's say I worked with that one internal part and their issue's resolved, I'll ask them, are you willing to help me with other parts? Yes or no? Will you show them that technique and let them know that anytime something's triggered inside, they can do that inside and you'll help them? Okay. You get phenomenal results doing that. They don't need, and what I want to do is not get all the phone calls. So anything I can do to put it in their hands, that's what I'm going to do.
I have one more question. Do you think archetypes are the same as inner parts, or do you consider them that way?
They can be.
The saboteur, the wounded child,
They can be.
and ask them to tap along with that work?
Mhm.
Oh, good.
Yeah, I think there's a lot of richness that you can mine there. I know that you will always find, male or female client, about a 13-year-old male who's tougher and snot, who took the most pain and trauma for them, who holds their anger, and will be the last one to heal, and I address that in that dialogue. Okay. You will always find a part with severely abused people whose job it was to choose to die, and I'll always address that also. Yeah. But what we're dealing with is, well, let me just say this, if you guys don't know this, most multiples, and there are many amongst us, okay, are in therapy 7 years before they're properly diagnosed. They usually have 8 to 9 psychiatric diagnoses. They usually have 5 or 6 physical diagnoses. Some of the tragedies that I've seen of someone come in who've had 15 surgeries, never found anything physically wrong, okay? And then work with them for a year and it's gone. But they have 15 scars and surgeries from chasing everything in the world. Never was there. Okay. So that just kind of gives you an idea of the things you can do with people, because, again, think about that. And I've probably worked with, 400 dissociative disorders, severely dissociative disorders. Never had a single decompensation over the phone, long distance, ever. Safest therapy in the world. It's about that time. Any other questions before we break for lunch? And then what I would like to do is break for lunch. Break. That's an unconscious lip. There were a few people with different autoimmune diseases that asked me to do some work with them, a lot more than we could. It might be interesting if they want to come up, if that's not screwing up things, if they want to come up with a chair here and do some tapping along. I'm going to work, is it Mary Lou? We're going to do a little work, and your issue was hearing. And so what we're going to do is just kind of walk through this, get an idea of what comes up. And I'll be doing some of this. And understand you don't have to do this to use these techniques. This just saves you a lot of guesswork. It allows you to laser in a little quicker. And since, 80% of the people picked it up in 5 minutes, probably if you guys spent 10 minutes practicing it, the rest of you could pick it up. Okay, so let's go ahead and take a short break.
On the muscle testing, when you're doing a yes or no, it's just a yes or no. It's not a monitor of how close to, if you're doing, I want to be well, I want to be sick kind of thing.
Yeah, let me explain that a little bit, because I know I went over that real quick. Basically, you're looking for a yes or no. Okay, now, I want to be healthy, I want to be sick. Some people will have me say, like, my name is Steve, my name is George. I don't do that because a lot of times there's parts inside whose name are George. Or I'm Steve, I'm Jane, same thing. And then they get really confused and gets them into a whole bunch of other issues. So I usually say, I want to be healthy, I want to be sick. Now, let me do this just so that if you want to write this down, if you're testing for toxins, there are 3 statements, and I'm just going to use wheat as an example. Okay? The first one is wheat. That's the first statement. The second one is wheat, I want to be healthy. The third statement is wheat, I want to be sick. I will tell you that your EVA machines, electronic acupuncture according to Vol, only test the first level. Many times they are wrong. When I was first tested, I was on 21 supplements or medications by an expert with an EVA machine. 19 of the 21 were toxins reversing me. That's how often they're wrong. So if it goes weak on wheat, wheat is a toxin. So you want it to be strong on wheat. Now this is a strong, this is a weak. Okay? So if it is wheat, that looks good. If it's wheat, wheat's a toxin. So if it looks good, you don't know anything. The second statement is wheat, I want to be healthy. If it goes weak, then wheat is a toxin that reverses you. If it goes strong, you still don't know anything. Wheat, I want to be sick, should go weak. So to those statements, you should have a strong response to wheat, strong to wheat, I want to be healthy, and weak to wheat, I want to be sick. Anything else, wheat is a toxin for you. Is that clear? When you're muscle testing, you have to be objective. You can make it come out any way you want. I have a firm belief system that says it's genetically impossible for a woman to accurately test herself for chocolate toxicity. I have never yet found evidence to the contrary. Okay. So, just to give you an idea, I would never have a woman test herself on chocolate. She needs a guy to test her on that. Because women will cheat for other women, see? And if you test a male for toxicity with remote control, he can't test himself either. So, just understand that. There was one other question about testing. Think about it. Go to the mic, please. Oh, I know what it was. Autoimmune disease. Yeah.
On what you just shared, when you said that wheat should be strong, in other words, if it is strong, then it's not a toxin?
No.
Or it is a toxin?
If you have to do all 3 to know the answer
strong,
to that,
strong, weak.
then it's okay. Anything else is a toxin.
Oh, okay. So if it goes strong, strong, weak, it's okay to eat.
If it's weak, the first one, it's a toxin. If it's strong and then weak, it's a toxin. If it's strong, 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 it's a toxin.
Okay, got it. Thank you.
Yeah. Now, let me say this real quick before I forget it, and then I'll come to you. With autoimmune disease, you're always going to find internal toxicity issues. Okay? And let me just give you an example. This lady wants me to work with her because she has a thyroid issue. Okay? And she has an eye issue. And one of the things I can tell you already is if I have her say, and I'm going to say it for her, she doesn't even have to say it, I want to be healthy, I want to be sick. She's not reversed. T3, I want to be healthy, T3, I want to be sick. She's toxic on her own thyroid hormone. That is always the case with a thyroid disorder. Her one eye, there's a problem. My tears, I want to be healthy. She's got a reversal for tears in her eye. That's why it's not healing. So I would treat that issue. Diabetics are always toxic on their own insulin. Okay? If you check with MS, you almost always find toxicity on the myelin sheath where the body's destroying itself. One of the things that's real easy with premenstrual stuff, menopause stuff, check a woman, she's always toxic on her own hormones, balance them using codes, it goes away almost every time. Someone came up to me today and said they've got a 15-year-old niece that has migraines. I said she's toxic on soy and her hormones and one other thing. And she goes, yeah, she's a vegetarian. I said, sure. But until they take care of that, then you're not going to be much help. So I'm just saying that's a whole nother area of testing people's internal fluids and then using the process for clearing them. There was a guy by the mic and he disappeared. There he goes.
Okay, so you asked us 3 questions. Wheat, I want to be healthy. Wheat, I want to be sick. Right? I want to be sick.
That's an age regression
That's
technique.
good. Age regression,
right.
right. Okay. Well, you then ask those questions then for corn or soy or dairy or for down your list.
That's right. Now I'll tell you, if you do this a lot, then you begin to recognize energy fields. So when she's talking about her daughter, I could look at her and say, okay, the daughter's toxic on corn, wheat, hormones. That's real easy because I know what it looks like. And when she thinks about her, I lock in on that field. Okay. So that's just because I've done it a lot.
I'll make this very brief, but you are incredibly accurate. She gets the migraines at the end of her cycle.
Right.
And she's vegetarian and eats soy every day,
Yeah.
so here we are.
Yeah. See, soy is another food that's mostly genetically engineered. It's a very tough protein to digest. I wouldn't recommend soy for anybody. Now, some women, soy actually helps with menopause symptoms if they can handle a certain amount, and you test for that. But yeah. Okay. We haven't worked together. We've talked about 2 minutes. Is this on?
Yes, we all.
I don't know about wired, but she's holding a mic in her hand. Oh, this thing here? Talk.
No, it's not.
Oh. There we go.
Okay.
There we go.
Right, we just met the first night I was here. We talked probably a minute or 2.
Right. And so why don't you tell us what we're going to treat?
I lost my hearing 3 years ago, suddenly, in the right ear. And I originally went to a doctor who said it would never come back. So I thanked him very much and told him I'd call him when it did come back. And I happened to be going to an acupuncturist right after that for my back. And he suggested that it was Candida yeast, a systemic infection all through my body. And he had me go on a diet. And so it came back about 20%. And that's all I told Stephen.
It's in one ear only?
It's in one ear only.
Okay, which ear is that?
The right ear.
And this is how I would handle. Now, one of the things is you might see me doing this because this is an easier test for me. Don't try to duplicate it. Nobody can do this. It just doesn't work. So I may do this instead of this. If I remember, I'll do this so you can see it. Anything significant happen in the year before that?
Quite a bit. In the 3 months prior to that, in the year before that, my father was dying for about a year.
Okay.
And I was in a very stressful relationship. And I think we were waiting for the holidays or my father to die before we broke up.
Okay.
So right before this happened, the holidays passed, my father passed away. And this gentleman and I broke up, but we maintained the house that we lived in. We stayed together for a couple months. And then I moved, and within 2 weeks after moving, he called me one night and didn't have really pleasant things to say to me. And instead of standing up for myself, I just got off the phone as quickly as I could, and the very next day my hearing went.
I wonder if anybody has any ideas. So I might be thinking, gee, I wonder if I don't want to hear any more phone calls.
Exactly.
And which ear is it? And which ear do you hold the phone to?
Both.
Okay.
Well, now only the left. But
Stay away from that ear. I've had enough bad news in that ear.
I definitely thought that
Okay.
I did not want to hear.
Okay. And the one thing that I might ask, and I'm going to do this instead of the way I get information visually because it's not very helpful for me to do it that way. Any significant trauma that you know of before the age of 5?
Physical
Any
is the
trauma?
only one that...
Okay.
I hate to admit this one, but...
You don't have to say anything but yes.
Yes, oh, okay.
You don't have to share anything you don't want to. Okay.
Well,
So-
I'll
okay.
I'll say it.
Give her a mic.
I fell on my head off of about a 6-foot porch onto cement on the top of my head. And I actually think I was pushed by my brother, but he won't admit it.
Okay. So at least we know of one trauma. Now, what I would be doing silently is I would be going, I want to be healthy, I want to be sick. Okay, she's not reversed, so I know I'm getting good data. Never hurts to check myself. I want to be healthy, I want to be sick. Okay, so I can get some good data. First thing I would ask is this physical or emotional? Is this physical? There's a physical aspect. Okay, is there an emotional aspect? Yes. Now, the other thing that's a little different, I'm going to go ahead and ask this because it's something I always do. I'm clear of any spiritual deception in my testing, because you do get deception in your testing, and that's clear, so I can trust my answers. Okay, is the physical primary? Okay, there's a physical primary part. Is the emotion primary? I'm getting yes to both. Okay, and what I do this a lot. Do I need to know more to treat this? Yes. Okay, is there a specific trauma? Okay, I got another yes. Do I need to know more? Yes. Now understand, I can be doing all this in about 2 minutes while I'm listening to them tell me their story. Okay, before the age of 5, yes. Before the age of 4, before the age of 3, okay. 3, so 3, 3.5, something happened. Okay, and I would ask, do I need to know more? I got a yes. Is someone else involved? Yes. Okay, is it a family member? Yes. Okay, do I need to know more? I'm still getting a yes. So what I'm looking for is some information. Now, I could not do that and say, because I'm going to shift back and forth, if you had something that happened before the age of 3 that you might not want to hear, what do you think that might be?
The arguments in the house.
Okay. Now, that told us a lot there. The other thing I might do is go back to the resonating memory protocol. And let me just do that because I want to walk you through some different tools. When you think about this hearing loss, I want you to give me a picture. And what specific picture comes to mind when you think about this? And it doesn't have to make sense with the issue. What picture comes to mind?
Holding myself.
Okay. When you look at that picture, what emotions come up?
Sadness and fear.
Okay. And what beliefs about yourself, about others, about the world come up when you look at that picture?
It's the world scary.
Okay.
About myself.
Yeah. Anything about yourself?
That I'm just not safe.
Okay. And again, you're going to see this come up a lot. If I were to ask you, what's the earliest picture you have that resonates with that same sadness and fear, that same I'm not safe, what comes up? What memory or picture comes up?
I don't remember much.
Okay. Now, I don't remember much.
Yeah. Oh, I got one.
Okay.
Well, I don't actually, it's just the kindergarten not wanting to go in this house. I don't know if that's nursery school or kindergarten.
Okay. Now, did you watch her start to access stuff that she didn't know she could get to? It was real obviously just by asking questions. And some of that is the tone of voice I use from all those years of hypnosis. And she's a hypnotherapist too. Okay. Do you have a picture of that house?
Oh, yes.
Okay. When you look at that picture, what's coming up?
I'm afraid.
Okay. Okay. Any thoughts coming up with that?
I remember the house. It was a dark house, and I remember little cots we were supposed to sleep on. And food that I didn't like. But that's all. I remember actually being outside in my mother's car, and taking cans from the grocery bags and throwing them at the teacher that was trying to get me out of the car because I didn't want to go in.
Okay.
That's all.
Okay. And you didn't have memories before about that?
I I vaguely think years ago, but I don't remember, I didn't remember this specifically.
Now see, what you've done is create a safe field for her to go there, or she wouldn't have gone there. And if she had no memories, that's when I would start asking questions and then ask your body, there's something that happened about this age. Just let it paint a picture. Now, I would ask now, I need to know more? No. Okay, I need to deal with this picture? Yes. Okay. I need to know more about this picture? We got to know. Now, is this related to the hearing problem? Yes. Okay. Now, do I have 100% cooperation in healing this now? Yes. Is the field 100% complete? Yes. Then I would stop. I wouldn't ask for any more information. Okay. Now, if I got no to any of those, then I'm going to start asking more questions. But I'm also, first thing I'm going to do silently is it okay to know more about this now? And if I get a no, then I'm going to say, can we work on this issue now? If I get a no, I'm going to find an issue we can work on now. Because I am not going to violate an internal world that says don't go there yet. That's the value of this. Because I want to take things in the right sequence for healing. Okay. So let's do this. If you think about that now, and I'm going to do this, it would help to tap? Yes. It would be better to just read it? No. Okay, and I'm going to ask, I call this the bridge position. That would be better? Yes. That would be better than tapping? Yes. Okay. I'm going to try one other thing because I do different things and I'm trying to show you guys a lot. It would be more powerful if I touch her and release the code. Yes. Okay. And sometimes you're going to get that. Now, you might not do that as a therapist, but I find working with females, I'm a very safe male. And a lot of times they would I ask for permission, I might touch their hand and I'm just going through the code and releasing it to them. And sometimes there's something about the actual tapping that may actually get in the way of the processing, the ability to stay focused on the picture and watch it change. So by reading it, they can do that, or me touching it and releasing it, it lets them stay with that picture a little more. So, and I've already asked, can I touch her? And she says, okay, but can I touch you? So let's do this. Since we're just trying new things, what I want you to do is just hold this position. And I'm going to ask, should I include the chakras? Yes. Okay. So I'm going to include those. I'm going to go the EFP point silently. I'm going to go all down the codes. Then I'm going to go down the front of the chakras and down the back. And I'm going to touch your knee if that's okay. Okay. I didn't ask for her SUDS level beforehand, but tell me what's going on. If you want, you can put your hands down. Just tell me what you're aware of right now, just in looking at that picture.
I was just thinking that my mother didn't listen to me.
Okay.
And that's been a big issue, people not listening to me.
Okay.
And physically, my chest is just heavy.
And I'm going to ask, should I point this out? I got a yes. And right before you lost your hearing, you weren't listening to yourself.
Right.
And standing up for yourself on the phone.
Right.
And I got that it would be better to say that. So let's do this. Why don't you focus here? And I'm just going to do the same thing. Now I can have her tap, but I'm doing this because sometimes when somebody's in a deep state, you're going to find if you have permission, it'll move them quicker this way. So let's just put your hands back there. And then I could have her just, and you can be thinking about the EFT code, but I'd rather have her focus on that sensation and that issue and no one listened. Just take a minute, as much time as you need, and then just let me know what's going on. Okay.
It's, seems to be breaking up.
What's happening with the picture? That specific picture of throwing cans, nobody's listening.
Part of that hearing, that picture was me hearing it happen, and I'm not hearing it anymore.
Okay.
I'm not hearing.
And see, one of the things I'm doing is bringing her back to that one table leg. It's okay to check those other things about the body sensations, but it's what's happening in that picture.
Mm-hmm.
So now you're not hearing what's going on in the thing.
Right.
And one of the things I might ask, I want to be healthy, is it okay to hear what was happening? Okay. If you were you hearing what was happening there a minute ago? In that picture, were you hearing what was happening
Yeah,
before?
yes, I was hearing it.
And what was happening before?
Before?
What were you hearing before?
I was hearing myself saying I didn't want to go in and screaming and crying.
Okay.
And then a lot of confusion around me, and I could hear the bag.
Okay.
And
let me ask this, for training purposes, if someone has an idea that's coming up to them, step up to the mic, okay? Because I think that's part of how we learn, if you're okay with that.
that's fine.
Okay. I know that I could see some things happening for people, so I thought I'd let her do that.
What was happening for me, since I have this hearing issue also, I did that same position that you did, and I need my issue is that I wanted nurturing from the world, and that I needed to know that that existed within me, and that I needed to give to the world what I wanted from the world.
Okay. Let me ask you this. If the hearing thing went away tomorrow, if your hearing totally returns tomorrow, what would change in your life? How would things be different?
I feel I'd be free to move forward.
Okay. And what's the first thing you would do if you could move forward? If you were free right now, what's the first thing you would change?
I think I'd be more open to letting people in my life.
Okay. Because I recognize feels, did you guys see the fear when she said, I would be free to move forward?
The fear?
The
is that
fear.
what you said?
The fear was very clear. What are you noticing here now?
Not much different.
Okay.
But maybe a little bit.
Okay. And when you think about moving forward and letting people in your life, what's coming up?
I think a mixture of feelings. I mean, one part of me maybe doesn't want to. I still want to.
What's your history been with people listening to you? Like mom didn't listen to you?
No, I was invisible, and my opinion didn't matter. And we would be quiet in my house. More from my dad than my mom. Actually, she ended up listening to me more.
Okay.
So that was a big issue that I just needed to be quiet all the time. And also the people that did talk to me, they were loud and mean.
And let me ask, what's the relational history with men listening to you?
No, they don't listen to me.
Okay. And I might ask, is there a belief there?
Yeah.
Okay. What's the belief? If I get in another relationship, what's the belief, and how might that be involved with this?
Oh, I think it's very important and very
Is there a
Yes.
belief that men don't listen?
Yes.
Okay.
And that they yell.
Okay.
I have to listen to them, but they don't listen to me.
Okay. I have to be quiet and pretty,
Yes.
but that's all.
Yes, and nice and sweet.
Okay. So again, if this goes away, then I'm going to move forward in relationships where my job is to be quiet and sweet and pretty and listen to them, and there's not much room for me. What kind of picture comes up with that?
It's not a good picture.
I'm going to break from this for a second. One of the things I'll often do besides collapsing a picture is test and see, do I need a love picture? And sometimes I'll have people do a split screen. So on one half, they're working with that pain picture. But if this issue was completely healed, and we're talking, and maybe that's with a man, what would a love picture look like on the other side in the kind of relationship you want with a male listening to you? Can you get a picture like that? Okay.
Do you want me to do both?
Yeah, kind of a split screen. And why don't you do this? When you get the split screen, I'm going to ask you what's coming up, and then I'm going to have you go ahead and tap a code out. Tap out the code a couple of times and see what happens with that. Because see, you've got, here's the old fear, and here's the new fear. And I'll say that on the mic. Sometimes it's hard for her to get a visual. Okay, that's okay. Okay. The picture of a sensitive listening male is kind of blank. Can anyone relate to that particular issue? Okay, let me help you. He's got a remote control, but it doesn't work, so the volume's off. Okay, we're going to give her some help here. When you have both those pictures, just start tapping through the sequence. While she's doing that, I'm going to mention something that last time when I was up here for just a minute a couple of years ago, I had somebody that came up to me and said none of the EFT codes had ever worked. And I tried to muscle test them, and they were toxic to everything that was cotton. Okay? And I've had somebody else say, I've been doing EFT and it doesn't work. The only time it doesn't work is probably if you're wearing or inhaling something that actually is blocking it at that moment. So if you've done and looked at several aspects and done a lot of things and it has not budged, I promise you, you're wearing something that's blocking it. That's the only thing that'll block it. Just as another tidbit that's pretty valuable. This person, for me to even test that, I had to have them call me out of the shower with nothing on. That's another aspect of phone work that makes that a little easier. State boards are a little easier. So I have actually done therapy with a number of people in the nude, both male and female. I wasn't nude, they were nude, because they were so reactive to everything else. Some of them were togas, but most of the time they had to get something that wasn't reactivating. What are you noticing with your pictures? I'll give you the mic.
Neither one of them are very clear. But the one on the right became brighter.
Okay. So the one that...
It was more of a feeling I had
Okay.
than a clear picture.
So the love picture became brighter.
Mhm.
And I didn't go into that a lot, but a lot of times if you ask for that pain picture on one side and you ask for, what is their heart's deepest desire, what would they do if this went away, and you put it on the other side, you have the two things they fear most in life. Okay. And so that's a real helpful technique, that at least something shifted in what you were afraid of.
Mhm.
Okay. What are you noticing physically right now?
My chest isn't as tight.
Okay. So there's some physical shifts. Let's go back to the original picture, and part of that is because of time, I'm not sure we're going to get through everything, and I want to have a chance to answer questions. The original picture of being in the car and tossing the cans, what's that tell us? We got one spunky lady here. I mean, somebody...
I think that's probably the first time I ever did anything like that, and the only time.
Okay. Okay.
It
So you
was
just
shock.
should have kept throwing the
It was
cans.
actually very shocking
Okay.
to my mother. And it was shocking to me.
And this is not a shot at your mom, but if you have a great kid that doesn't do that and all of a sudden they go ballistic, I don't think drugs. I think I shouldn't take them back to that house. There's a reason, and I'm sure there's a reason. And one of the things that I might look at further is, let's go back and ask the body about what happened in that house, and do we need to release that and do some work on that, because there's something that was driving that behavior. We have a question over here I'm going to address.
Yeah, I'm really quite confused. How does what you're doing here relate to your 2 to 4 minute sequences? Because this feels very familiar, and the concept of 2 to 4 minutes boggles my mind.
Okay, 2 to 4 minutes over the phone for me is I would identify the trauma the way I do visually and say something happened at this age. I want you to focus on that, and I want you to repeat this code and check back with me if the suds on it's not completely gone. So that's how I would do that. This issue, we may actually deal with 6 or 7 traumas in short sections that they work on off the phone. On the phone, I just give them the information and then they work on it and they call me back. And they could stay on the phone, but it's much cheaper to get off the phone and do the tapping. So that's how I do it.
So they have to be familiar. So your clients must be familiar with the tapping.
Absolutely. They have charts. They know where all the points are.
Oh, okay.
Yeah. I would think all of your clients after the first time, if you were to say, I need you to tap out the code, the EFT sequence, they would know what that would be because you've shown it to them.
But if people call you just like that, how do they know about EFT?
I fax them a manual or some getting started quick sections that show all the points, that show and explain that. It takes them 5 minutes to read through it and they look at the charts. Where I can email that or fax that instantly. Yeah. We got another question over here.
Yeah.
Oh.
You used asked her to get a picture, and she had a hard time with the last. I have a lot of clients that have a hard time visualizing. Do you ever go with sound or
Yes.
other?
Yes, I would go with what they have and try to be as specific as what they have. For example, if she only had the sensation of setting in the car and maybe the heat in the car and setting back in the seat, that's what I would go with because that's what we have to work with.
Okay, thanks.
You bet.
Okay, I kind of have 2 questions. One is, do you find that it's any different working with problems that aren't as obvious, like high blood pressure or endometriosis or things like that? That's one question. And the other question is, what about like a smoker or somebody who's in a constant kind of toxic state or somebody who's on medication?
I think that you have to put the body in the healing state. The thing is, when it's a subtle issue, then you don't have a way to test for that. That's where letting me know, is this the key trauma I need to work on for them? Because they don't have a SUDS level on hypertension or endometriosis. Is there something blocking that healing? And sometimes you're going to get hypertension that's genetic. You're also going to ask, do they need to address some physical things, some dietary things, some exercise? And so understand there is a belief that says if we just tap on the right thing, then we can eat anything we want and have any lifestyle we want. And maybe I have a belief that blocks that, but I haven't seen that be real successful. So I think there are some other things you have to address. What was the second question? Toxicity? Yeah. I will find often with somebody who's got chronic depression, we can eliminate it very quickly. But you have to treat the smoking addiction because the ammonia in the cigarettes will keep re-triggering it. And so a lot of times you have to find out what's re-triggering it and treat that issue. With medications, if it's a medication that's a toxin, then you can clear that. Most of the time, let me say this, frequently you can clear that with tapping. You can use the EFT sequence. I do more advanced things with that because that's kind of a tough issue for a lot of people. A lot of times I'll test them, and if it's a toxin, ask if their physician would be comfortable handing them some samples of something else. So maybe we could find a hypertension medication that's not a toxin, because the body's not going to work well. If it's a toxin, it's not going to work well. Now, if the body needs it, the body will say, do some energy work on it, balance it so it can assimilate it better and have less side effects. Yeah. What are you aware of right now? Okay, we've got about 5 minutes, so we can do some more work on this later. But do you have anything you would want to report?
I'm not aware of much change.
Okay. And see, one of the things that I would be testing for is there another core trauma? Yes. And I might ask, is it something in that house? Yes. Okay. And I already kind of did this silently. Is it okay to do that now? No, not in public. And so I would leave that issue, and then I will work on that later. So there's something that's dissociated that you don't have a memory of. The body says, I want to do that in private. That's okay. And I've always respected that. But I think it's very unlikely that there's an instant hearing loss that's truly physical. Now, I've had tinnitus and hyperacusia before, where everything was so loud they had to wear a towel around their head. They had been to the Mayo Clinic, had done a lot of work, and this was a physical issue. I scanned them and I said, you have a fungal infection and you're wearing something on your body that's poisoning your liver. And they said, how did you know that? And I said, well, we don't go into that. Let me just, what are you doing? They said, 6 weeks before this, I went to Mexico. I got a fungal infection and I'm using this cream. I said, get rid of the cream. We treated the fungal infection. It went away. And within 24 hours, the ringing in their ears went away. They called me 4 months later. It came back because I ate some toxic barbecue sauce. And we had to retreat that, and it went away. But they had spent about $200,000, very wealthy individual, had been in several major hospitals, and they couldn't find anything. And he was suicidal. He went around with a towel around his head because the sound of somebody writing on a pencil and paper would send him to the roof. So sometimes it's emotional, and sometimes there's something physical in the field.
You're saying mine's both.
Yours both. There's something physical there too, and we'll look at that. I did test, it's not inner ear fluids. But see, a lot of times you might have had a trauma that caused the inner ear fluids to test toxic. And that may be the physical issue. When you resolve one, it may resolve the other. And I know we didn't touch base here just because of our time frame, but we may check and see how you guys, just briefly, did anything come up when you guys were looking at some of those fields and pictures? Okay. So just to report with some other pictures, some other incidents came up. But again, there's something that the body said, it's not safe. I've got to shut this down. Or, and for years there wasn't a lot of autoimmune disease. It was just shutting down hearing. For somebody else, it may be cancer. It may be diabetes. Diabetes is always a milk allergy also, just to know. Milk is absolutely poisoning the pancreas. That's why you have some groups that have a milk intolerance, like Pima Indians, certain ethnic groups, and if you test them, they're all toxic. They're all lactose intolerant. And it's the milk that's killing their pancreas. That's why they have diabetes.
How do you go about testing for the toxicity, the physical part at this point? Can you run through that?
For her inner ear fluid?
Yeah, just the same way with
I want to be healthy, I want to be sick. Inner ear fluid, I want to be healthy. Inner ear fluid, I want to be sick.
Now, it doesn't show up there. Where do you go next?
In terms of for her, if there's something physical?
Yeah.
I would ask, is it a toxin? Is it within the body? Is it structural? I would be asking questions like this. I also have several thousand diagnostic vials that have energetic signatures that allow me to pinpoint physical things very quickly.
What are the signs in your body that you are toxic to something?
Say that again, the what?
What are the signs that you are toxic to something?
Well, it depends on the person. It can be anything. It can be a person with itchy eyes that's toxic on their tears.
You must have a physical manifestation?
Not necessarily. You can have somebody who's toxic on their own neurotransmitters and they have a very ADD or picture or brain fog. That's not what you think of as symptoms. You might have someone who has a lot of emotional issues, a lot of chronic pain, it's their hormones. You might have somebody with a sleep problem, and if you test, it's their melatonin.
Oh, okay.
Do you see what I'm saying? So if you know body systems, you have a pretty good idea of what to look for.
Okay, thank you.
I think we're about done time-wise unless there's another question. And this is a big topic, and so we just went into one aspect. Any other questions? I have one over here. Yeah. And understand that this work has lots of layers. When you're doing with these kind of things, you're rarely going to have one session. And so now, like the guy with the ear thing, it was physical, so we didn't have to do any trauma. And what was rare in his case is he had 0 ingested toxins, which is very unusual for tinnitus or hyperacusia. There's almost always ingested toxins. So usually on an autoimmune process, it's more complex. You're going to spend some time looking, like Gary would say, at a lot of different aspects to completely get the table to collapse.
I just wondered if you had treated anybody in, say, the early stages of Alzheimer's, because later, obviously, they don't have the cognitive wherewithal to do that kind of work, but any luck in that area?
I haven't done much with Alzheimer's. I just haven't had those clients.
Do you ever work with anyone who has autism?
Yes.
Does it work? It works well.
Autism, there's a lot of variables. A lot of times you have amino acid issues. A lot of times you have vaccination issues that caused it. So it really depends on what the cause is.
So can you use the codes to clear the
You can use the codes
toxic?
to clear that. You can, it varies. I've had people have very significant recoveries. I've had other ones that have had no response. I've had others that have had partial response. But I would always check for vaccination residues and some other physical things with that.
And then a moment ago you mentioned about hypertension and how sometimes it's genetic. Is there anything you can do for that?
Well, let me say this. Usually something like hypertension is multi-causal. You may or may not have a genetic factor, okay? You usually have a lot of stress factors. A lot of times there's belief issues in that, and that's where we really go after the emotional things. When it's more functional like that, you're obviously going to get a lot more of it. A lot of times you have lifestyle issues and toxicity issues. I've seen people that collapse their hypertension when they quit eating sunflower seeds.
Wow. Thank you.
So it's a multi-causal issue usually. And understand that a lot of physical things have a lot of different aspects. Now the core issue blocking the healing is going to be an emotional issue. But management-wise, you often have to address these other things.
Have you ever worked with somebody with Huntington's disease?
No.
Any thoughts on that?
You know, I would kind of go through and scan physical, emotional factors and just see what I get.
Okay, thanks.
A lot of times I don't know until if something's in front of me and I can look in the energy field, then I have a lot more data.
I realize that you do this for a living, so you're usually in contact with people, but do you do what I'll just call distance healing? Sometimes, like if you had a relative and you made a choice to go ahead and do something knowing, well, never mind, that it doesn't work unless they accept it anyway. Do you do that kind of thing, or do you need the formal things you've been teaching us today?
If I get permission, I'll do remote work for someone, if I get permission.
Cool, thank you. I have a grandson who has autism, so thank you.
Well, you know, one thing it's interesting that I've done a lot of, and this is something you can use, parents come in with a teenager that's got a lot of anger issues or depression. Have the parents do remote work. Tap on it. If you will test like this, I guarantee, I've never had a teenager not give permission for the parent to do remote work on them. I've had phenomenal results with that, where the parent thinks about the kid's depression and they go through the code. And they think about their self-esteem issues and they go through the code, focusing on them. Sometimes it helps for them to go and just give their kid a hug and release the work. They don't necessarily have to do that. A lot of very effective work done that way. I call it kind of guerrilla therapy. They don't know they're getting sabotaged or hit. If you have permission, though, you know.
No, that's my question. When you're saying if they have permission, do you check for permission, or are you physically talking to them?
I would check. I would say, testing for John, I have permission to do this.
Right, okay.
I'm open to this intervention.
Yeah.
And if I get a no, I don't do it.
Cool. Thank you.
Yeah. The man. Well, I was going to see if there's any other questions, and then I was going to let you come up and wrap things.
All right. Why don't you just close? I was going to come up.
Okay. Well, I guess we're closed.